I think every program's looking for the very best to come and join, but what we really want is people who are going to fit into this close-knit family type of fellowship that we have.
As a foreign medical graduate, you really apply broadly, and so Jacksonville was one of the places that I knew was very diverse and took individuals from different backgrounds and different medical schools, and so this was one of my options.
I had a good friend of mine who was a trainee here, who was a fellow here. He had a good opinion about the programs. Came here to interview and I liked the place. Overall, the environment was enticing.
I think it's the combination of the faculty that are very supportive in medicine and then all in the different departments, including gastroenterology. Even as a resident, they made you feel a part of the team, and now as a fellow, I just feel like I have a lot of support.
Everybody is accomplished, they're smart, they're hardworking, they're motivated, they're intelligent, they're driven. But beyond that, we want somebody who's unique, somebody who is going to just come in there and light up the room with the rest of the group.
We're such a great group of individuals that we really support each other, and I think the transition for any fellow you can talk to them was quite easy as well.
And everybody has their own expertise we could learn from, which I think makes it a very fantastic place for us to train at.
Everyone is interested in learning, and it's an experience. Everyone is happy to be here.
I think my colleagues are fantastic. We have a great time. We hang out outside of our program here, outside of the hospital. We're all friendly. We're all supportive to each other. We look out for each other.
We cover for each other when needed. We're kind of like a small family. Everybody knows what everybody's doing.
Because at the end of the day, you spend your time with these people more than you spend with your own family. So it's important to have that good work environment where you feel comfortable and you can laugh and you can cry with these people, and it's just an overall great experience.
So there's really a very rich environment of both academic learning as well as really bread and butter gastroenterology that we really think brings out very well accomplished gastroenterologists that are able to just hit the ground running the day they leave this program.
Our attendings specialize in almost everything from hepatology to interventional GI to nutrition, motility. So there's a lot of variation in the things that you get from this program.
Our fellows get an extraordinary amount of hands-on training. The average fellow comes out with 1,500 procedures under his or her belt, which I think is really remarkable.
You can pretty much be very comfortable doing any procedure after you finish training here.
I also knew with the patient volume that I would be able to get my procedures without any issue and come out of this being able to handle pretty much any situation, which was a big factor in me wanting to stay here.
The support we have from our faculty and our own staff and fellows, that's what trumps everything.
I really love that they tailor our education to our level of training as fellows and based off of our interests. So there's always someone to go to. You can call them at any time or approach them about a case that you think is interesting because they find it very interesting. So it's very inspiring and it makes you want to continue to grow and to learn.
It gives you the right amount of autonomy versus hand holding, so you never feel like you're swimming in an ocean by yourself and you're trying to stay afloat. It's never like that. We really have great relationships here.
We're very close with our faculty. You can text them at any time.
We have their cell phones. They're there for us 24/7, even if they're not on call.
No one is intimidating. You can really contact anyone of the faculty. You can contact anyone of your other fellows or residents.
There's a lot of good camaraderie between our endoscopy staff and our fellows, which makes our day-to-day life very easy to navigate through.
We try to foster an amazing work environment where everyone gets along. That's really important, not only to grow yourself as a physician, but as a person.
So I think it makes a great place to learn and grow in and even settle down.
We also have 2 research coordinators, so there's a lot of research opportunities. And they keep track of all of our ongoing studies, and we have a lot of large randomized control trials that we're a part of, so we get to take place in research meetings, sometimes international meetings, and we learn a lot as far as research goes as well. I think UF Jacksonville is special because it's a safety net hospital. We get patients from all over Florida and Georgia.
We serve a very underserved community, the majority of the patients who do not have private insurances.
It's also a level 1 trauma center, so the pathology we get to see is very diverse and complex. We work close with the surgeons, the colorectal surgeons, and just general surgery, so we have a lot of complicated endoscopic cases that I think a lot of people don't get to see elsewhere.
When you look at treating those kinds of individuals, you have to be a lot more patient and a lot more understanding, and that really makes you grow as a clinical gastroenterologist, trying to help everyone from varying backgrounds.
You'll vary in a single day from really bread and butter community type practice to quaternary super specialized care where you're working someone up for a liver transplant.
So it's been nice to see the different parts and the different diseases that we see here.
The variety of the pathologies that we see and the experience we get, it's been truly a great learning experience.
The most of the cases we see here are advanced cases, which sometimes we don't see in other suburban populations. That was one of the reasons which made me pick this program over other places.
If you're interested in really complex patients, lots of diversity, lots of challenges that go beyond just the medical challenges. We have a lot of social challenges that we have to overcome in our patient population as well. But that's, I think, what makes the whole experience so enriching.
At UF Health Jacksonville, we have access to our simulation lab. We practice under guidance of our faculty, but at the same time, we can go on our own time to practice versus a variant of procedure technique. It's really a wonderful resource, especially for our first-year fellows, to try to the basis of endoscopy and introduce them to the actual endoscopy suite, and gives them a chance to hold the scope before they start practicing on real patients. And it has a simulation, like they give you a scenario in the beginning, you start to practice what you're going to do in real life, but without harming a patient or anything for the first time to hold the scope. And then under guidance from our faculty, who also teach us how to do the techniques, and then we practice on ourselves on our own time.
It's a good city. It's actually one of the, I think, the largest city in the state of Florida. It's very spread out, and there's a lot of different areas and things to do.
It's a growing community. It's a very big city.
It's coastal life, but it's city life.
But each area is so different, from the beaches to the historic area. There's so many different places that you can live and get a different feel. So I really like living in Jacksonville.
It's where Georgia meets Florida, which is fun and interesting.
I like how it has a southern feel. Everybody's very friendly here.
Once I came from Egypt, this was like, I didn't move from Jacksonville. I always have loved Jacksonville from day one I came here. I really love it, so I didn't want to leave it.
It's a place with a reasonable cost of living, lots to do. We even have not too shabby sports teams like the Jaguars.
Coming from Pennsylvania, obviously a cold environment, so I definitely found Florida to be a much better weather. There are amazing restaurants everywhere, every cuisine you could find.
You have all kinds of ethnicities here as well, so you can find your area which suits you better.
There's a lot of young professionals here, so even when I have some time off, there's the beach not too far away, and then there's the downtown area, so it's got a lot, and the food is actually really great here as well.
And I think the testimony is that if you look in our city, the vast majority of gastroenterologists in practice here are trained here. It's a very memorable 3 years when you come and work with us.
I see now it's a really close-knit program that really brings the best out of you.
Clinically, you will be very strong after you come out of this program.
Usually by the time you're a third year, you have over like 1,500 to 1,000 cases, which is a lot more than other places.
You're in Florida, the weather is amazing, you have a great patient population, there's no lack of procedures here, and then just the support of the faculty.
I love it here. It's a great place to work, from the attendings, the fellows, to the nurses and techs. Everybody's happy. It's a good learning environment. I've really enjoyed my time here.
I would tell them that it really is about having positive and uplifting work environment, and hopefully we do get to meet these individuals soon.
I'm always impressed when the fellows call me back a week or two after they've finished their training, and they always remember what they got here at the University of Florida. I think at the end of the day, that's what we want.